This video is part of the Connecticut Health Policy Project's Advocacy Toolbox. We offer simple to understand resources to help consumers navigate what can seem to be a confusing health policy landscape. The Toolbox is made possible in part with support from the Connecticut Health Foundation. All the links and resources mentioned in this video are available in the Toolbox at cthealthadvocacy.org. If you'd like more help, you can contact us at the bottom of each page on our website. Part of advocacy is finding out what policies already exist. Many policies are set in state law, also called state statute. The best way to learn if there's already a law addressing your issue is to call your state senator or representative. Check our toolbox to find your state legislators and their contact information. They have staff who can search statutes easily, or they may already know. You can also call your local librarian or ask the legislative library for help. Again, links to all these resources are in our advocacy toolbox. If you want to search the statutes yourself, all state laws and proposed bills are online. Searching can be a little complicated, but it's not hard to do. This video will take you through a search. The steps to a search are also written out with screenshots in the toolbox. To start, go to the state's statute search webpage. The link is in the toolbox. Leave the defaults checked for section text at the bottom and stems in the middle of the screen. The most important step is to choose your search terms. First, try the most obvious wording. If you're looking for laws about the Husky program, try Husky. Most of the time, this will work well and get you what you're looking for. However, at times, the legislative term for something isn't what the rest of us call it. In that case, try using similar words. You can check a thesaurus or ask other people familiar with your issue. It can be helpful to search the general State of Connecticut site with your term. You may find a document that uses your words, but also gives others. For example, if you are searching for laws about surprise medical bills, using the term surprise bills finds only 4 references of documents. But using the term out of network returns 21 references. Both of those are reasonable numbers of references to look through and find which are relevant to your question. You can use broad or narrow terms to get a reasonable number of documents to scan through. For example, Medicaid returns 272 documents, 40 per page. That's a lot. But Husky is mentioned 51 times in statute. That's a much more reasonable number. Leaving the default contains the phrase requires that your term is exactly used that way, as if you had quotes around it in statute. If you use the drop down and change it to contains all, that will return all documents that use the words in your search box, but in any order and not necessarily together. That'll return more citations. For example, a search for prescription medication contains the phrase gives 4 documents. But the same search, prescription medication with contains all, returns 25. Let's try a search for Husky. Here are 51 documents. When you have your search down to a reasonable number, you can use the title to scan through the titles of the documents, the sections of the statute, to see which one, narrow it down to see which one to look at. You click under the name these links to the left of that title to actually get to the document. Let's look down here and see, here's the Council on Medical Assistance Program Oversight, the MAPOC Council. That's a very important piece of Medicaid in Connecticut. We'll click on the link, and the link takes you to the statute that describes the council, who the members are, the scope of the council, how often they meet, what they look like. And you see that your search term, Husky, is highlighted in yellow. In very long statutes, it can be very helpful to be able to skip through and find where the yellow is. You may have to search a few times to find what you're looking for, or to assure yourself that there isn't a law governing your issue. Good luck with your search and in moving policy. Unless people like you get involved, nothing will change, but there is help. All the resources and links mentioned here are available in the Advocacy Toolbox at cthealthadvocacy.org. If you have questions, use the form at the bottom of every page on our website to let us know. Good luck.